Welcome to the Literally First Class podcast, where I will teach you how to overcome anxiety and achieve somatic success. I'm your host, Carrie Ford. I'm a somatic success and holistic life coach here to bring humor, insight, and wisdom to the modern day woman that wants to feel alive in her daily life. You ready? Come on, I saved you a seat in first class. All right, well, welcome back to the Literally First Class podcast. And today we are having a pop-up party in first class. And you guys know that I do not often have guests on here. So this is someone very special, very dear to my heart, and someone that's doing really big things in the world. And I felt extremely called to have him on the podcast, especially because my DMs have been absolutely blowing up, as you can imagine, given my recent experience with my breast explant surgery. So I am so excited and so honored to welcome our guest today, Dr. David Rankin of Aqua Plastic Surgery. How are you today?
I'm doing really well, Carrie. I'm happy to be here, and thanks for having me on.
I'm so excited that you're here. So I would love for you to just briefly introduce yourself to anyone that's not familiar with aquaplastic surgery or your specific line of work.
So my name is Dr. David Rankin. I'm a board-certified plastic surgeon, and I specialize in breast explant surgery. We're located in Jupiter, Florida, and I've been in practice. I'm going on my 20th year now.
Wow, 20 years.
Hard
That's
to believe.
amazing. I love that. So I didn't even speak to you until the day of surgery, which is somewhat mind-blowing, I think, for some people, but I had done enough due diligence on researching you, and I felt like you had done enough, operating on public figures and people that were very forward facing in the public eye, that I felt like, well, we would know if something hadn't gone quite right, because he is operating on the best of the best. And also there's such a huge fear, and it's been extremely heartbreaking in my DMs to hear women's stories that are deathly afraid of what they might look like after they have their implants removed. It has such a grip on our identity. And I'm curious if you see this in implant patients that come in that maybe even go as far as to have a consult, but just fear takes hold and they talk themselves out of the explant surgery altogether.
Yeah, fear is very common in my patients. Most women who get breast implants, they never anticipate wanting to remove them. And they're very scared about how they will look after surgery. Many of my patients do come in for a consultation prior, or we'll do a virtual, but I have a lot of patients like you who just travel from out of town, and we talk day of and come up with a plan. And that's my job, really, is to just be honest and give them an opinion of what I can do, what I can't do. And I try and always do my best for aesthetics postoperatively, but that's very, very common with my patients.
You were spot on with my assessment, because I remember going into day of surgery, and just at that point I had committed to, I don't know what breast tissue I'll be left with. I made a joke, to my boyfriend, I hope you like nipples. That might be all I have left here. But at that point, I felt so terrible in my health. And it became so apparent to me that these were tied to breast implant illness and complications anatomically due to the implant size and being under the muscle, that I was like, I don't really care at this point. But I also knew and had this massive deep trust, because when I got on the phone with Jeff Rose, who is one of your explant specialists, and you'll talk to him as you navigate approaching, being on your wait list and signing up to work with you. He told me that you're one of 7 explant specialists in the United States. Is that true?
Well, there's becoming more of us, but I did set out and focus my practice on explant surgery. There's been a couple other pioneers in the industry before me that have been doing this longer than I have. But there is more of a focus on it with other plastic surgeons now who are seeing the tremendous benefit that it's giving patients. So the focus is swaying heavily towards the direction of explanting with some surgeons. Of course, some surgeons are still heavily implanting right now as well.
Sure. Yeah. Do you still do implant surgery?
No, I haven't done them for going on about 5 years now.
Was there a specific reason that you decided to stop doing them?
Really, as I started explanting and seeing the health benefits to my patients, I didn't want to be, it's a little hypocritical for me to go and put implants in only to take them out when they're having problems. So I just wanted to focus on the explant side. And there's enough challenges with just explanting and trying to become the best at that's just been my focus.
Honestly, I know that you have quite a long wait list. I think when I first signed up, it was a 20-month, but I know it's been up to 2 years. And I actually I made peace with, God knows my path. He'll choose when I'm ready. And if it's 20 months, it's 20 months. If it's, if I'm on the cancellation list, awesome. But I actually have had peace about knowing that this is the only thing that you specialize in. He can only get better between now and 20 months or 24 months because you're constantly, when you're committed to your craft and mastery, I imagine like anything, you have X amount more surgeries under your belt at that point. So I'm like, my boobs are just going to look even better.
Well, like anything in life, experience is key. So practice is definitely perfect.
Oh yeah. What would you say is the number one reason most women come to you for explant surgery?
It's really to do with their health, whether they're having health issues, they just want to be more natural, changing the focus on their life to a more natural lifestyle. It's usually, though, health complications, and they've really checked off every other box. They've been to a multitude of specialists, and they can't get any answers. And this is almost like a last resort, leap of faith type surgery to see if this is their answer.
I resonate so much with that. I felt like I had over the span of 2 years when it really started to become evident to me that something wasn't quite right, that these migraines weren't, not only were they not going away, and I'm pulling every trick in the book as a holistic somatic practitioner and coach myself, knowing my body extremely well. And I just thought something's not right. We're getting mold tests. I've got a hormone panel. I'm 39 and, I'm like, okay, maybe perimenopause, but I'd kind of gone through all of the same things. And it was the minute I had a conversation with Jeff, and he suddenly put words to an experience I never had before in a way that nobody had ever connected the dots. And that was that the implants, when placed under the muscle, can cause some anatomical issues, which was it was too big for my body and it was under the muscle. And I went back and I read the surgery notes, and I think it's important to note that these can cause some really strenuous things on the physical body, not just the immune system and neurological effects, but, you know, you wrote down that it was almost impossible to anatomically guarantee or rearrange because the pectoralis muscle was so high and tight. Can you speak to that and how you see the anatomical rearranging or the accommodation of implants and the issues that that poses?
Yeah, well, that's another reason why women want to explant too, is the anatomic issues. So when implants are placed, when they're placed under the muscle has to be cut in the lower portion to allow proper placement. So then the implant goes in and it tends to push the muscle northward over time. And it's hard to reestablish full anatomy postoperatively after an explant surgery. When an implant is placed, it's a foreign body. The body doesn't know what it is, so it forms a capsule, which kind of walls off the implant also, and that capsule can have issues too. We call it capsular contracture when it squeezes and distorts the shape of the breast. We always try to reestablish as much anatomy with, like you were talking about, with the pec major muscle, which the implant is placed under, but it's not always possible to do so. Fortunately, most of my patients usually have normal range of motion and normal strength postoperatively, despite these confounding issues.
Do you think insurance should be covering explant surgery?
I'd like to see it happen with insurance. You know, their main concern is to not pay. It seems so.
Totally.
They definitely don't want to take on a new diagnosis, and I think that their thought is, well, these women put these in themselves electively, and we shouldn't cover it. But these are serious health issues that women are facing, despite how they were, placed. And I think that with time, insurance will cover it, and I think there's definitely a push to do so.
Yeah, because I'm imagining now post-op, the potential risk of animation in the muscles, meaning like movement, beyond that's abnormal to the muscle, post-op, or even necessary physical therapy. I mean, I've had reduced grip in the left hand. I've had tingling and reduced feeling in my ring finger and my pinky for years. And I thought it was from a lifting injury. And again, this was another one of those things that I was like, this is the thing that's not really going away. It's very odd to me that my range of motion in my shoulder has not increased. In fact, it's decreased. And the migraines have, become more frequent and more more intense, and chiropractic adjustments just aren't really offering reprieve. So, do you see a need for physical therapy beyond surgery with breast implant removal?
It really depends on the patient. Some
Yeah.
women explant and range of motion and strength and their physical being goes back to normal right away. It's the patients that have issues still postoperatively with shoulder mobility, arm mobility, some of the things that you've talked about. I will send to a physical therapist to kind of help out.
Wow. Yeah. So I have to ask the question, and I'm sure we can all guess what the answer will be, but knowing that you now just explant and that you're not putting implants in the body anymore, and your word was that it's like it seems hypocritical to do that, to put the very thing in that's causing all these issues only to then take them out. Do you see that causing ripples in the industry of plastic surgery? Because people make a lot of money putting these in women's bodies, and I don't feel that I had informed fully consent of the risks.
Yeah, it definitely has, and there's pushback from colleagues. I think what's sort of happening is there's more of a push, like you said, towards informed consent, understanding the risks, benefits, possible complications before surgery, and every woman deserves to be informed. And I think in the past there wasn't a push to do so. So when you're an adult and you know the possible risks you're going to face, then you can make a choice. But when you're told these are lifetime devices and they're going to have no issues and you're going to have no problems, I don't think that that's very fair.
Yeah. What do you think is the biggest thing that's missing from giving women fully informed consent when they're sitting on that table and they're at a consult for a potential implant? What's missing, do you think?
It's just there's a black box warning on the implants now. There is recommendations from the American Board of Plastic Surgery about informed consent, which has come a long way. It's just I don't think that every surgeon is presenting these to the patient before surgery. They're sort of ignoring them in certain circumstances. Um, and there's a disbelief, whether it's through financial gain or, really haven't seen
Mm.
the outcomes of these women, that's kind of pushing things in the wrong direction as well.
What's on that black box warning that might be important for women to know?
That the implants may cause systemic issues, some of the health issues. There is cancer linked to the implants, which is very small, but it's
Oh.
present. Um, you know, Chances of having a repeat surgery are very high. That most women will need another surgery. So there's really a pretty concise list. I think that we're headed in the right direction.
Hmm.
That the informed consent has definitely come a long way, and it's been a benefit to patients.
Yeah. What I wish I knew was that it's the silicone shell that actually can present silicone bleed in the body. Most women are talking about, well, what implant do you have? Is it filled with saline? Is it filled with silicone? And what I learned, at least from the explant documentary, and I don't know if it's true, but it seems to be like this new information and that they've known about this, which is in fact every implant is surrounded by a silicone shell, and that in and of itself is what is actually leaching into the body.
Well, the silicone implants and the saline implants do have a silicone outer shell. We know there's some leaching, like you said, outside the implant. Thoughts in the past have been that number one, that it doesn't, but we know that it does,
Mm-hmm.
or that it's contained within the capsule that forms around the body, which some studies have shown that it definitely does not get contained in a lot of cases. The industry has consistently tried to change the formulation of the implants and make them what we call more cohesive. So, less chance of leaking, but, I question whether we're really there yet. Even with the newer implants, a lot of women are having health issues that I see in my practice and are getting better after explant.
Oh, wow. Yeah. So I'm guessing you believe in breast implant illness because many women have kind of been gaslit and told, like, this is a psychosomatic experience. This is not real.
Yeah, it's 100% real. I see it firsthand every day. I do, upwards of 500 explants a year. Most of my patients feel better after explanting. So if it's not placebo effect. You can't make up the numbers. You can't make up the experiences that I'm hearing from women. Like we talked about, no women wants to remove their implants, but when they feel better after they do, then it's worth it to them.
Yeah. Do you see women taking legal action on their previous plastic surgeon for like lack of informed consent or potentially medical malpractice. Like, for example, I don't remember being presented with a choice. Hey, you can do them above the muscle or you can do them below the muscle, but here are the risks between the two. You're 5 feet tall and you have a petite frame. So if we do X amount of cc's in your body, just know that the risk could be that you may end up with this brachial plexus injury and all the other things that come with it. Because I'm like, this is new information to me and I had made implants for 7 years.
Yeah, I mean, I don't see a lot of legal action towards the doctors. There's been some legal action within breast implant industry,
Mm-hmm.
some of the problems that have been caused. As far as over the muscle, under the muscle, size of implants, these are really important things that the doctor and the patient have to discuss prior to surgery. That, there's benefits to both, there's risks to both, and those should all be discussed prior.
Yeah, absolutely. My DMs have been filled with heartbreaking messages and questions and concerns. Women are wanting to have the courage to elect for explant surgery. And I find that there's one of two things holding them back. That there's the expense, which is, how am I going to do this? I've just,
Yeah.
I paid already so much money to have these in. And now I'm paying in health bills currently because I'm navigating health challenges due to the explant or due to the implants. And it's an added expense. Then the other is fear, which is where I've, offered some support and I created a guide. And I just thought, my gosh, like I feel so blessed and lucky to have the baseline of personal development and the somatic work that I do within myself. But so many women don't know how to navigate that identity shift or know that their worth and their value doesn't come from their breast size. They're literally panic stricken with what might be left behind. What might you say to those women that are just scared?
Again, it's just a conversation of risks, benefits, how they may feel post-operatively. A lot of times, just on consultation, I can get a good idea of what needs to be done and what the possible outcomes are. And we always weigh it against the severity of symptoms too. So, if the patient comes in, they've had implants in for 10 years, they feel great, they like the way they look. Should I have them removed? Well, no, it all comes down to your health. Certainly, every woman with implants does not need to have them removed if they're not having problems. But it's important for them to understand if they start to get health problems to put this on their what we call differential diagnosis, that maybe this is a possibility too. And it's really comforting to women when they've ruled everything else out to know that this may be their answer. And lo and behold, in many cases, it is.
Yeah, absolutely. Wow. And that's such a testimony to the integrity and the man that you are, which is, I'm not here to just take the money. If it's not really urgent or it's not something that's yet on their radar, then maybe now is just not quite the right time yet.
Yeah, it's definitely not a surgery to be taken lightly. You have to, fully think about it and, know every possible outcome that can be and know how it may affect your lifestyle.
Absolutely. And so now you developed a signature lift called the J lift. Do I have that right with the explant surgery?
Well, it's kind of, every surgeon has their bag of tricks that they learn over the course of their career. So I just took, a lot of techniques that were really already developed and made it into a way of doing the scar and moving the tissues. I have gone sort of full circle back to more traditional lollipop type lifts, which is around the areola and straight down. I just thought with the J lift, it was the scar was a little bit not as up and down as I would have liked. So looking in a mirror, symmetry, and so I've kind of gone away from that and I'm back to a
Okay.
traditional lollipop or anchor lift in most cases.
Okay. And what is the lift? Because I've been calling it a modified lift that you performed on me, but it was like an arc incision that we did because I had a previous lollipop lift and you go, this is what I so appreciated about your just everything about you. It was like, let's just not cut you up to cut you up.
Right.
let's let's take into account your current breast tissue and volume, your age, your previous surgeries, how the scars have healed if you've had any before. So I had the lollipop lift with a skin reduction and implant. So I had a full anchor. I had the lollipop scar and that had healed pretty nicely. And you said, I think these have healed nicely. I'm noticing one areola is higher than the other. Let's even that out. You've got about a B cup of breast tissue and came up with a really what I felt like I felt very heard and a very beautiful solution to what I was looking for, but also like what's realistic and doable. So can you talk more about like what a modified lift might look like for somebody who has had a lollipop lift? And I know it's probably still on a per case, per, per consult basis, but would love to know more about what you specifically did with me because that's been like a huge question people have asked.
Yeah. So with every patient, you have the shape and you have the scars. So oftentimes you achieve a better shape with more scarring, and you achieve less scarring and sacrifice some of the shape. So you want to try and treat each patient individually. With you, just we did measurements, and your old implant had just kind of lowered your bottom portion of your breast. So that's the only area that needed to be adjusted. So we call it a horizontal lift. So it's just removing some skin from the bottom of the breast, leaving the areola alone, not doing it up and down. And, I think you got a great result. But experience and just understanding there's a lot of different types of lifts, and you can't cookie cutter this. It has to be individualized for every patient.
Yeah. And are there times, and I'm sure yes, but want to just curious, are there times where you're in the operating room and you have to make a game time decision like, oh, geez, like what we said we were going to do, like now that we're in here, we have to pivot.
Yeah, 100%. And usually I will tell those patients, like, for instance, I'll say, let's do an explant first. Let's sit you up on the table and see whether or not you need a lift. Sometimes
Mm.
we're done at that point, and sometimes that's where I say, yes, we need to do it. So I don't want anybody to be surprised. I'm not going to do a full lift when we haven't discussed it. So if they don't understand that that's a possibility, I certainly wouldn't do it, but I try and be proactive with that and discuss it preoperatively.
Yeah, thank you for that. Oftentimes I keep hearing stories too where women wake up with bigger than they wanted implants.
Yes, I
Not
hear
really
that
the,
one.
the game time decision that you're wanting or expecting, where you're like, gosh, I really went in thinking I'd be at like 250 or 300 cc's, and here we are at 400, and like, holy moly.
Yes, it's definitely not something you want when you have discussed something different.
Yeah, absolutely. I feel like that feels complete to me, although I'm curious if there's anything else that you would like to share with the audience or with women that are struggling with potential, struggles with health and really curiosity around explant surgery.
I really think every woman needs to be heard with the symptoms that they're feeling. I think a lot of doctors brush them off. Like you said, they get gaslighted tremendously, particularly when it comes to implants. And with the advent of social media, which I think has been huge because women are getting together and collectively speaking where they can't be silenced, has been really big for the industry. And doctors and plastic surgeons need to be educated that this is real, and that they should be thinking about this when women are having health issues.
Yeah, I think that that's where there's a huge gap. I remember going to my chiropractor after my conversation with Jeff, and I was like, she goes, "So how are you today?" I said, "I'm good, but I have some new information." And the neck pain that I've been struggling with, I've realized now that that's connected to my implant, which is under the muscle and has shifted my neck and caused all sorts of issues. So no wonder we're not seeing any increase and, improvement. And she's like, "Thank you for teaching me." And I was kind of pissed off. I don't really want to be teaching my chiropractor about the body. And so I would love for chiropractors and people that are not just in plastic surgery, doctors and in the medical field or in the wellness space, to have this on their radar and know that this could be the reason why. This could be the root cause of the things that we're seeing on a symptomatic level, like that we are just treating with medications or band-aids, and we're not really addressing the root cause, which could be implants.
Yeah, I do get referrals now from a multitude of other specialists, rheumatologists,
Wow.
OBGYNs, a lot of naturopath doctors. So the word is getting out, and once they see their patients back postoperatively, it really just solidifies their thought process. And so I think we're making inroads, especially talks like this. Speaking with you, bringing up such an important topic, I think goes a long way. Also,
Yeah, and my hope is to support women with the somatic component and bringing in the self-love and releasing some of the fears and moving through, the things that have a grip on them that keep them from making the decision to have the courage to have the explant surgery and know that they are perfectly worthy and beautiful on the other side. And I mean, there's just so many women I even see, and I'm like, I had this moment where after I'm looking at my boobs and I'm like, these are so great. Why did I ever get implants? They're
Mhm.
so cute. Like, why did I ever think I needed them? And it just became this very sweeping conversation. I remember back when I was on that, table at a consult and I went in for a lift and I came out with a plan for a lift and an implant. And so it wasn't that I was talked into it, but I was open to it because it has become so normalized. Like, well, this is just what you do after you have kids. And then you just get your body back. But I feel like it's anything but getting your body back. In fact, it made me feel more disconnected to my body because now my body's having to figure out what these things are and accommodate them, anatomically and symptomatically. So anyway, I'm so glad to hear that the word's getting out and that you have these referrals. That's incredible. And that other doctors outside of this specific space are putting this on their radar. So there's less of a gap and it's not invisible any longer.
Absolutely.
Do you have mentors that you look up to in this space around explant or breast implant illness or colleagues that you often defer to?
There's a group of young explanting doctors that we all, you know, bounce things off each other as the space kind of develops a little bit more, just kind of perfecting our techniques, even post-operative care, preoperative care. There's not one, doctor in particular, but there's kind of a group of us that are, trying to make the industry better.
I love that. That's great. Thank you so much for your time, Dr. Rankin. I'm so excited to just continue to give you more exposure too through my platform and through our voice collectively, because I know that women have been silenced and they feel crazy. And especially when you have those really bad days and then there's really good days, pre-explant, and you're like, well, maybe I'm fine. I remember having this conversation with myself, like, maybe I can just handle the migraines. Maybe it's okay
Right.
because I was scared to have them out. And there's again this identity and like deep rooted sense of worthiness and value. But when as soon as they meet you and when they get in touch with your team, my advice would be just schedule a consult with your team. Just get in touch with aquaplastic surgery because they will immediately put you at ease and you can just trust your intuition. And if it's a no right now, it's a no. But if it's a yes, lean into that and, you know, encouraging you to have the courage to get these out and reclaim your health. So thank you for the work you do.
Absolutely. And it's a pleasure to speak with you about it.
Yeah, absolutely. Thank you so much, Dr. Rankin.
Okay, thank you.
I hope you enjoyed your flight, and I'll see you on board again soon.
Seriously, though, thanks for listening. If you're ready to take this work deeper and upgrade your mind, I want to invite you to join us inside my Millionaire Mindset program. This is where you'll start using my guided meditations to help you overcome anxiety and experience even more abundance. When you join, you'll have access to my entire audio library. Head over to elevatewithcarrie.com and we'll see you inside.